Hi, this is Dr. Prasad, implantologist and prosthodontist, KIMS Dental Care, KIMS Hospitals, both Kondapur as well as Secunderabad HOD. Today our topic is root canal treatment. What is root canal treatment? Normally, first of all, we should know the teeth and its architecture. The teeth contains layers. The outer layer is the enamel and inner layer, in between the layer is dentin and inner layer is the pulp tissue. Whenever the infection demineralizes the enamel and enters the dentin, and once it enters the pulp, then you will get a very shooting pain, where most of the previous days we used to do only extraction of the teeth. Now that is not the case. Now we are removing the infected pulp. When it enters the pulp, the infection, it only limits in the pulp area. Then we will do root canal treatment in a single sitting and we will cure that one. And if not, if it enters into the bone, that is the apical portion of the root, then we will do root canal in 2 or 3 settings until the infection got reduced. How we are going to do the root canal? Root canal treatment, just opening the chamber and we are removing the infected nerve tissue. We will open, shape the root canal, we will open and we will place the inert material and we will close the root canal this thing. Once if you close the root canal treatment, that is just called as root canal. Instead of removal of the teeth, we are retaining our natural teeth for another 15 to 20 years. That is called as root canal treatment. What are all the precautions we have to take in the root canal treatment? Means the first thing and foremost thing is, root canal treated site, you should not eat for the first 1 week, because at the time we need some time to heal those tissues in that area. And second one is, root canal should be completed perfectly. After that, in the meantime, you have to take the medications properly at the time of root canal treatment. And foremost and important thing is, whenever you have undergone root canal treatment, the teeth will become brittle. There is lot of chances of fracturing the teeth. If the teeth got fractured, we have to remove. There is no other option to retain the teeth. To prevent that one, we should provide a crown on top of that, which prevent the fracture of the teeth, and it aids in the strength so that you can eat properly in the thing. The fourth one is, whenever you feel like you are giving more load on that area, then definitely you should visit the dental surgeon and clear the loaded area in that site. And final one is, root canal treatment, every 6 months you should visit the dental surgeon. You should check how is the root canal treatment teeth is acting or not. This is what is root canal treatment. Root canal treatment is a very simple procedure. This is not at all a complicated procedure. Most of the people think it's a very painful procedure and all that, but this is a very, very simple procedure. Nowadays, with lot of latest technology, we are doing that one in a single sitting only. Along with the help of lasers and microscopic, we are doing perfect root canals without any failures. So don't worry about the root canal. Whenever you feel like decay and tooth pain, if any of the nearby dental surgeons, if they say extraction, you can just think of, instead of going for an extraction, there is any option to retain your natural teeth, because natural teeth is more precious. You won't get your natural teeth back how much ever you spend money in the form of artificial teeth. So please don't sacrifice your teeth for the sake of just decay which entered into the nerve tissue. Please undergo root canal treatments and save your teeth for the next 20 years, which acts just like your natural teeth.